It's a healthcare staple, normal saline. But professionals in the industry tell us it's been hard to come by for more than 6 months. And right now, they say there's no end in sight. It's not an emergency situation yet, but doctors insist something must be done to increase the supply. News 13's Catherine Mazzone is live at Presbyterian Hospital with the story. Catherine?
Doctors here at Presbyterian say up to 90% of their patients receive normal saline at some point. But with the nationwide shortage, they tell us they're having to get creative to ensure they have enough for everyone who needs it. Normal saline. Doctors and first responders use it for things like treating dehydration and administering medication through an IV. But nowadays, many are thinking twice before they hook up patients to these IVs.
It's extremely frustrating. It's been affecting our ability to render patient care in some cases.
Joseph Chacon is a special projects manager for Superior Ambulance. He says the saline shortage affects all aspects of patient care.
We've been fortunate to meet our needs for our patients, but with the prolonged shortage, it's getting more and more difficult.
It's why he says they're having to get more creative to meet those needs.
If the patient absolutely needs the fluids, they will administer it.
Representatives with Presbyterian confirm it's not just first responders seeing the shortage. They say the solution has been in short supply since August. Doctors tell us they've been taking conservation measures as much as they can without jeopardizing the safety of their patients. According to the FDA, there are a number of factors that have put saline in short supply, but indicate a greater need during the flu season as a contributor. Presbyterian doctors agree, saying it only made the shortage worse. They tell us they have an incident committee that meets every week to monitor supply and say they have plans in place to avoid a real disastrous situation. Now, we reached out to all 3 saline manufacturers to learn more about the shortage. We heard back from 2, Hospira and Baxter. Representatives with Hospira tell us their shortage isn't due to any sort of manufacturing issues. Representatives with Baxter say they're working hard to make the solution available on a more predictable basis. Back to you.
All right. Thank you, Catherine. Presbyterian Hospital's medical director of patient safety says there is a bigger issue at hand. She says she's been seeing drug shortages for the last 5 years, affecting safety and raising prices.